we weren't going to have their first birthday or school, and I think the pathway will help parents create memories that they will benefit from for the rest of their lives.
No parent ever imagines that they will be in this situation. And the devastating loss of a much loved baby is a journey that will last a lifetime. The bereavement pathway is so important because it's the start of our journey, and at the start of that journey we need that compassionate care to be able to essentially set the tone of how our lives will develop from there.
The pathway is important to try to make sure that all bereaved parents in Scotland receive a high standard of care, because we know that in our own discussions that care can vary even within health boards.
I hope the difference that it will make is so that families can feel confident with the care they receive and that they don't get lost in a system.
My son Izzy, or Isaiah, was born at 22 plus 5 weeks last March, and I think one of the real challenges about that was him not being legally recognised as a person, or me as a mum. So I think the pathway is really important because it means that women and families are going to be treated as individuals compassionately, and even more importantly, our babies are going to be treated as our individual children and people that matter.
You can never go back and change how things were, so it's absolutely vital that communication, care and memory making is excellent.
The difference I hope it will make is that it will be more compassionate care, more carefully worded terminology, and emotional care will be taken for early losses.
We were lucky. We met a charity who were great, and we've had support from them for the past 2 years. But I understand that that's not the same. That's not the case for everybody.
I hope that families whose child dies suddenly or unexpectedly are treated with more dignity and more respect because of the pathway. Often in sudden death, the police are involved, and whether intended or not, families often feel that they are to blame for the loss of their child.
I hope that in the future that the parent has somewhere to turn when they leave the hospital and the doors close behind them, that they're given a contact, so that at that point in time when everything is fuzzy and doesn't make sense and you're just putting one foot in front of the other to keep going, that you can stop and regain something and pull it back together, and then think, I'm going to talk to that person, I'm going to call that person.
I hope it makes a big difference, but I think even if it just makes slight changes to people's attitude, and to not be seen as a medical statistic, to be seen as a person, and that baby to be seen as a baby and part of your family, is really important, and is really important with readjusting to your new normal.
I think it will make a difference throughout Scotland that all parents and families will be able to make the same memories because they have such a short time to make those memories, and that will be there forever.
I hope that it will allow parents to acknowledge that it's a baby that they've lost, and that no matter what stage it's at, that it was important to them, and that this is part of their family now.